Your time starts now.
Okay. Hi, good morning, Mrs. Khan. I'm Dr. Maida here. How can I help you today?
Doctor, actually, I'm worried about my kid, Yusuf.
Hmm. Hmm.
He's 7 years old and he's wetting, he wets the bed most of the nights and he's getting very upset about it.
Okay, Mrs. Khan, may I know something more about it?
Yes, doctor, actually, he's been doing it like 4 to 5 nights per week and he's doing never consistently dry at night for more than a few weeks. And in the
Oh,
day, he's completely dry. He doesn't have to go like more frequent to the toilet. But I don't know how to
mhm.
decrease it at night.
Hmm. Okay, Mrs. Khan, is it okay if I will inquire few more questions?
Sure, doctor.
Okay. Um, Please tell me that how old is, what is the name of your child?
Yusuf.
Is Yusuf, and he is 7 years old.
Yes, doctor.
Okay, and you told me that you have been facing the problem of nighttime urination for Yusuf, and in the daytime he is dry.
Yes, doctor.
And he was he ever dry at night also, or never dry at night?
He goes, but it's not more than a few weeks.
Few weeks. Okay, and then again this problem starts, and this episodes
Yes.
happen few times in a week.
Yes, 4 to 5 times
Okay.
per week.
4 to 5 times. Okay, Mrs. Khan, may I know that about something about his birth history? Yusuf was born normal or cesarean?
He was born normal.
Okay, and any complication happened during delivery?
No, doctor.
Hmm. And what about vaccination of Yusuf?
It's up to date.
Okay, and may I know, Mrs. Khan, where is Yusuf today?
He went to school today, so that's why I'm here.
Mrs. Khan, is it possible that you can bring Yusuf next time along with vaccination card so I can have a look of vaccination card and I can examine Yusuf also? Is it possible?
Sure, doctor. Sure,
Hmm.
doctor, but he's shy. He doesn't even want to be seen because of this complaint.
He feels awkward.
Yes.
Okay, I can understand. No worries. We will proceed with some more question, and then I will be in a better position to give you some suggestion. Mrs. Khan, tell me about nutrition of Yusuf.
He's eating well.
Hmm. And
And
yes, please.
he tends to be like more constipated. Sometimes he gets hard stool
Hmm.
every 3 to 4 days.
Okay, every 3 to 4 days. He used to pass stool
Mhm.
every 3 to 4 days. Okay,
Yes.
and like stool are quite hard, and is it with pain?
Yes, doctor. Not pain, but it's just constipated 3 to 4 days.
Constipated. Okay, and are you giving any treatment for that?
No, doctor.
Mm. Okay. Tell me, Mrs. Khan, about his like growth. His height and weight is according to appropriate
Yes,
as
doctor.
per his
Normal
age.
growth. Yes.
Mm. And okay, Mrs. Khan, tell me that like what do you do when you face this problem of nighttime urination? What is your behavior with the with Yusuf?
Doctor, I try to be be very gentle with him, but sometimes I shout at him also.
I can understand your worries. Do you have more kids?
No, doctor. This is my only kid.
Okay. And do you have any family history of same problem, like the same history in his father? Any idea?
No, no, doctor.
Okay. Okay. And Miss Khan, did you notice anything like on the back passage, any abnormal thing in the back passage of Yusuf?
No, doctor.
Did you notice any shaft of hair on his back, lower back?
No, doctor.
Mm. Did he ever complain of severe abdominal pain?
No, doctor.
Okay. Did you ever notice spilling, soiling of his underpants?
No, doctor.
Okay. And did he ever complain of weakness in lower limbs?
No, doctor.
Hmm. May I know that does Yusuf drinks like is he fond of taking a lot of water or juices, especially in the evening time?
Yes, doctor. He drinks a lot of juice and fizzy drinks in evening.
Mm-hmm. Okay, Mrs. Joseph, Mrs. Khan, did you ever try any remedy to overcome this problem?
No, doctor. I tried talking to him, but some of the weeks he gets better. But again, I don't know why the problem is getting
Mm-hmm.
back again and again.
I can understand. Okay, Mrs. Joseph, what may I know to whom do you live?
I live with my husband.
Mm. And what your husband thinks about this problem?
He says that some kids in the childhood does this thing.
Mm.
It's normal. He gets better, but I don't think so,
Mm.
doctor. He's already 7 years now.
I can understand your worries. And Miss Khan, may I know that by any chance are you pregnant?
No, doctor.
And when was your last menstrual period?
It was 2 weeks ago.
Mrs. Khan, may I know someone smoking in your home?
No, doctor.
Okay. Ms. Khan, may I know what do you think that what is going on with Yusuf?
Doctor, I'm just worried it might be going wrong with his kidneys or any psychological
Mhm.
problem.
Mhm. We will definitely talk about it. And what is your main concern?
But I'm really concerned about his own health. He's embarrassed. He wants to be like his friends also.
Mm. Mhm. Okay. And what do you think that how can I help you today?
I just want to know if anything can be done, like beyond waiting.
Mm.
Should he need any
Mhm.
treatment?
Sure, we will discuss it. And is it impacting your life?
Yes, doctor. Now I'm concerned about him.
Mm. Mm. Okay, Mrs. Joseph, I would like to summarize sorry, Ms. Khan, I would like to summarize. Yusuf is your child, 7 years old, and he has been suffering from a condition which is like a nighttime wetting. He has never been dry more than 2 weeks, and but daytime he is like completely dry. He has also problem of constipation. You are worried that it could be a serious issue, and you want to get rid of this problem. Am I right?
Yes, doctor.
Okay, Mrs. Khan, looks like that Yusuf has been suffering from a condition which is called nocturnal aneurysm. It's a condition in which the child usually not able to control on his urine at night time. But this problem can be fixed with some lifestyle modification and maybe medicine if needed later on. So, is it okay if we will talk about different options?
Sure, doctor.
Okay, first of all, Miss Khan, I will tell you some lifestyle modification. I can see few issues in Yusuf, like as you said that he's constipated. So, to relieve his constipation, if can you give him low high fiber diet and less fizzy drinks, and rather replace fizzy drinks with lot of water and plain water and fresh fruit juice. Is it possible?
Yes, doctor. I'll try.
Because I think that once the constipation will relieve, like his other problem will get better also. And one more thing that in evening time, please restrict fluid intake, especially 2 to 3 hours before sleeping. So he won't be like he would be dry. There will be more chances of having the dry night. Is it possible?
Yes, doctor.
Moreover, you can offer him reward like for every dry night, you will give him some sticker or reward that will encourage him to be more compliant with the dry nights. Is Can you do it?
Yes, doctor.
as you said that you are always gentle with her, with him. So please continue your the same thing. Don't like punish him or like scold him, and also tell your husband also, because this way child will lose his confidence, and that will make it more difficult for him to control urine. So can you do it?
Sure, doctor.
Another method is like alarm method. Can you put an alarm at night and encourage Yusuf to go
Thanks.
washroom at this? Okay.
Okay, so your next case is Mrs. Sharma, 34 years old female, came to discuss her problem with you. Please proceed with history, examination, and management plan. Your time starts
Oh.
now.
Hi, good morning, Mrs. Sharma. I'm Dr. Maida here. How can I help you today?
Doctor, I have this bad itching in my hands, and it's really making me bad, especially at night.
Itching your hand. May I know something more about it?
Sure, doctor.
Mm. Please tell me some more details about itching.
Yes, doctor. Actually, it's been 3 weeks now. It's gradually worsening, itching, and mostly in between my fingers. And
Mm.
it's just waking me up at night, also, doctor.
I can understand your concern. Ms. Sharma, tell me, is it okay if I will ask you more questions?
Sure, doctor.
Okay. Ms. Sharma, can I have a look of area which itch?
Okay, I'll stop the timer.
Hmm.
Sending in the group.
Hmm.
Timer starts again.
Okay. Okay, Ms. Sharma. I have seen your hand. I will ask few more questions, then I will be in a better position to tell you something. Tell me, that, Mrs. Sharma, is anybody else in your family having same problem?
Yes, doctor. Actually, my
Hmm. Hmm.
my kid also starting to have this itching, but he doesn't
Hmm.
have
Hmm.
anything visible on the fingers.
Okay. Ms. Sharma, tell me one thing. Is there anything which makes your itching better?
No, doctor. It's just all time itching, but in the morning it's better, in night it's getting worse.
Hmm. And anything which makes it worse other than nighttime?
No, doctor. Nothing else.
Hmm. And is it spreading all over your body?
Yes, doctor. Now it's between like my underarms also and the
Okay.
thigh side also.
Okay. Okay. Is it in between your toes also?
No, doctor. Not toes. Only just upper side.
Okay. Fingers. Okay. Mrs. Sharma, may I know that do you have any long-standing skin problem, already diagnosed skin problem?
No, doctor.
Is there any history of insect bite?
No, doctor.
Okay. Do you have any complaint of dry skin long time?
No, doctor.
Okay. And tell me, Ms. Sharma, that did you notice any bugs, bed bugs at home?
Not at home, doctor, but I work in
Hmm.
a care home.
Okay, okay, I can understand. Okay, and did you notice that other people affected same condition in that place, your workplace?
I don't see doctor because many are
Hmm.
there. They are every
Hmm.
kind, every age people. They have some other
Hmm.
problems also. I don't know if I got it from there.
Okay. Did you notice any scaling in any part of the body on this itching area,
No,
crusting or
doctor.
scaling? Okay.
No.
And Mr. Sharma, may I know that how is your house? Is it a crowded or congested house, or is it a open airy house?
It's open house.
Okay. And how many people live in with you in your house?
Me, my husband, and my son.
Okay. May I know, do you share same room?
Yes, doctor.
Okay. And tell me, Ms. Sharma, how is everything at home? Any stresses?
Everything is fine, but we are concerned about it now.
Okay. And tell me your how is your height and body weight?
It's 24.
24. Okay. And what is your dietary habits usually?
I'm trying to eat healthy, doctor, but sometimes this itching is not letting me do anything.
Hmm. Hmm. Okay. Mrs. Sharma, I have a personal question. Do you have any relationship other than your husband?
No, doctor.
Okay. By any chance, any sexually transmitted diseases you faced ever in your life?
No, doctor.
Okay. Thank you for your cooperation. Tell me, do you smoke
No, doctor.
and alcohol?
No, doctor.
Okay. Any other recreational drugs ever used?
No, doctor.
Okay, Mrs. Sharma, I would like to summarize your condition. You have been suffering from this itching on your hands and your like thighs. Also, it's spreading now. It's for, since few weeks. It's like your child has been also suffering from same kind of itching. And you work in a, I think, old home, and you are worried. Sorry, I forgot to ask you a concern, Mrs. Sharma. May I ask you one question that what do you think that what are you suffering from?
No, doctor, I thought maybe it's eczema at first.
Okay. And what is your major concern?
Doctor, now I am embarrassed that maybe I'll spread it to the residents also.
Hmm. Okay. And how can I help you today?
I just want any treatment plan and advice on any
Hmm.
family and environment.
Sure. And is it affecting your life?
Yes, doctor, been few weeks now. I'm not able to concentrate on my work.
And is it affecting your sleep also?
Yes, doctor, waking up at night.
I can understand your worries. Okay, Mrs. Sharma, I would like to summarize that since few weeks you have been suffering from itching in your hands and other parts of the body. Your child has been also suffering same thing. You have been thinking that it could be eczema, and you are concerned about spreading this infection to other people. And you want me to give some medicine to relieve this pain, itching. Am I right, or you want to add something?
No, doctor, that's all.
Okay, Mrs. Sharma, based upon your history and examination, looks like that you have been suffering from a condition which is called scabies. Do you know what is scabies?
No, doctor.
Actually, it's an infection by small insect which spread by contact and it causes itchiness. And yes, you are right that it can spread from one person to another. And like your other home members and your workplace people are they are they you can spread this infection to them also. And it is due to like bug which lays eggs in the beneath the skin, especially at night. That's why itching is very worse at night, but this can be managed with some medication and some lifestyle modification. So is it okay if we will discuss one by one?
Sure, doctor.
Okay. As I told you that it is a infection, but this can be treated with a medicine, and the most effective medicine is called permethrin 5%. Is it possible that you and your all your house, all the people living with you in your house can start treatment same day? Like I will give you a permethrin 5%. You have to buy 2-3 bottles of that. You and your all the people like your kid and your husband have to apply this medicine at night, all the body except your eyes. Okay. And keep that medicine for at least for 8 hours. And in the morning, you have to take shower and remove clothes, take a bath, and all the clothes, bedding, pillow covers, everything should be washed with hot water and put in a sunlight. Is it possible for you to do this?
Yes, doctor.
Though it sounds weird, but please make sure that everybody will take treatment same treatment at the same time. In case you will wash your hands or go washroom at night, you have to reapply that medicine, because this medicine needs at least 8 hours on your body to start to have a good action. And for the safe side, you can repeat same treatment after 1 week, so there will be no chance of this reinfection again. So can you do it?
Yes, doctor.
Moreover, I will give you antihistamine, like for as you have so much itching, I will give you a loratadine tablet, which you can take at like any time in a day. It won't cause sedation, but it will decrease your itching. I will give you a lotion which is called calamine lotion. You can apply for itching, because itching won't go uh, till maybe 6 weeks even after treatment. Don't worry, itching lasts for many weeks. So, but ultimately it will go away. So is it okay for you?
Yes, doctor.
Okay. Mrs. Sharma, I forgot to ask you, by any chance, are you pregnant?
No, doctor.
Okay, Ms. Sharma. So this medicine is okay for in pregnancy also. So don't worry and just apply this medicine. And there are some precautions that you have to wash all your like bed sheets and clothes. And the clothes which are not possible to wash, you can close them in a plastic bag for 72 hours. And you can do school exclusion till 72 hours, sorry, 48 hours till your first
Thank
application of
you.
this medicine. Trim your nails so you won't itch your skin. Okay. Thank you for your cooperation.
Okay, your patient is Mrs. Brown, 72 years old, male, came to discuss. Sorry, Mrs. Brown, female, came to discuss her problem with you. Please
Hmm.
proceed with history, examination, and management plan. And just 1 minute.
Hmm. Hmm.
Okay, your time starts now.
Hi, good morning, Mrs. Brown. I'm Dr. Maida here. How can I help you today?
Doctor, actually, I have this new headache on the side of my head, and it hurts when I so much in the morning.
Hmm. Hmm. Okay. Mrs. Brown, I'm so sorry to hear about your headache. May I know something more about it?
Yes, doctor, been 3 weeks now. It's on one side of my head, and sometimes
Hmm.
it's always present dull ache type of pain, but sometimes it's really worse and like
Hmm.
sharp. And sometimes I wake up at night because of it.
Hmm. Hmm. Okay. Mrs. Brown, is it okay if I ask you a few more questions?
Sure, doctor.
May I know which side you have pain, right or left side?
Right.
Okay. And does do anything which makes your pain better?
No, doctor, nothing is making it better.
Okay. And anything which make it worse?
Yes, doctor, many things like if I brush my hair, then I'm getting this
Hmm.
headache. And when I
Hmm.
touch myself, like on the side of the scalp or on the even eyebrow,
Hmm.
so it
Hmm.
gets
Hmm.
worse.
Okay, okay. And if I will rank it intensity, I want to know the intensity from 0 to 10. 10 is the maximum. Uh, what do you give it, like which point you will give to the pain?
Doctor, 7 to 8.
7 to 8. And can you tell me that this pain started suddenly or gradually?
Suddenly. But it
Suddenly.
stays there
Oh,
with a low
hmm,
intensity and then gets sharp.
okay. And does this pain radiate to, I mean, move to somewhere else or only remains on the side of your face?
No, doctor, only side. And sometimes, doctor, when I'm eating, chewing food,
Hmm. Hmm. Hmm.
uh, it gets worse.
Okay. And do you feel any vision change, any change in your eyesight along with that?
Uh, Occasionally, I felt blurred vision with this. for a few minutes.
Okay, for a few minutes. Okay. Did you feel any weakness, any part of your body with this pain?
No, doctor, just I feel
Hmm.
generally fatigued, and sometimes I
Hmm.
also feel low grade fever.
Low grade fever. Okay. Did you ever felt that there is excessive tearing from that side of eye?
No, doctor.
Okay. Any redness in the eye?
No, doctor.
Did you had any history of trauma on that side?
No, doctor.
Hmm. Did you ever felt that this is the worst headache of your life?
No, doctor.
Hmm. Do you feel like you do you dislike lights and noises when you have this pain?
No, doctor.
Okay. And anybody else in your family have same type of pain?
No, doctor.
Okay. Do you have any diagnosed case of any long-standing illness?
Yes, doctor. I have this high blood pressures.
High blood pressure. And are you using any medication?
I'm taking Ramipril 5 milligram.
Okay. Is your blood pressure under control?
Yes, doctor.
Hmm. Okay. Any other medication are you using?
No, doctor. Only this. Sometimes I
Hmm.
take paracetamol because of this headache, but it doesn't relieve me.
Hmm. Hmm. Okay. And tell me that did you have ever had any history of hospitalization?
No, doctor.
Do you have any drug allergies?
No, doctor.
Okay. And may I know to whom do you live?
I live with my husband, and one son is taking care of me.
So your family is supportive?
Yes, doctor.
Hmm. Okay. Everything okay at home?
Yes, doctor.
Hmm. Okay. And may I know, are you doing something for your living?
No, doctor. I stay at home just.
Okay. And what your husband is doing?
He's a businessman.
Okay. Tell me a personal question. Any problem in private relationship?
No, doctor.
Okay. Do you smoke?
No, doctor.
Any alcohol intake?
No, doctor.
Any recreational drugs?
No, doctor.
Okay. May I know about your height and body weight?
It's 28.
Hmm. And may I know, do you have enough time for exercise and walk?
Doctor, I go sometimes, but not like a lot.
Hmm. Okay. And what is your dietary habits usually?
I'm taking this junk food mostly, and I try to reduce salt, but somehow I
Hmm.
just eat whatever I like.
Okay. May I know what do you think what's going on with you?
Doctor, I'm just worried about any stroke or brain tumor now.
Okay. We will definitely talk about it. And what is your main concern?
I feel very anxious about going blind after I read online
Hmm.
that it could be stroke or brain tumor.
I will explain you. And what do you expect from today's consultation?
I want any urgent test and treatment.
Sure. And is it impacting your life badly?
No, doctor, but now it's so many times I want any treatment.
Mhm. Okay. Um, um, Miss Brown, I would like to summarize your condition based upon the history you have given me. Looks like you have been suffering from a condition which is called trigeminal neuralgia. Are you aware of this term?
No, doctor.
Hmm. Actually, it is a condition in which nerves of the upper face become affected due to any pressure or any trigger. That's why there is a sharp electricity-like pain. There is no cure of it, but we can treat it and control it with decreasing the stimulus or exacerbation and some giving some medicine. So, I will discuss about your medicine and like different ways. Meantime, is it okay? I will send some investigation and I want to do a quick examination for you. Is it okay?
Okay, doctor.
Okay, I will sanitize my hand under complete privacy. I will do your general physical examination. I will specifically check your eyes, nose, ears, and teeth. I will ask you to please, I will check the sensation on your face, both sides, and compare the sensation. Then I will ask you to clench your teeth, and I will check your temporomandibular joint. I will ask you to close your eyes and don't let me open, to blow your cheek and don't let the air escape. Then I will ask you to, I will check the pressure of your eyes with a gentle palpation. I will do your neck movements, and then I will I will check your eye reflexes with a light reflex. I will do your visual test of the both eyes, and I will check all the cranial nerves. I will check your jaw reflex also, and I will ask you to do say ah, and I will check your uvula movement. I will ask you to cuff, and I will ask you to shrug your shoulders. And I will check the power in your upper and lower limbs. So anything positive, please let me know.
Blood pressure 150 by 84, low grade fever, temporal side tenders, thickened and reduced
Mm,
pulsation on the right side. Visual
mm,
acuity is
mm,
slightly reduced on the right versus left, and otherwise
mm,
normal.
mm, Okay. Mrs. Brown, based upon your examination, that is it okay? I will give you a medicine which is called carbamazepine, 100 milligram. I will start twice a day to see its effects, and then come back to me after a few days. Meantime, I will send some of your investigation which include full blood count, LFT, urea, and electrolyte before starting this medication. And if your symptom will not control, I will send you to refer you to a neurologist to increase the dose of your medicine. Okay, and if you have any sore throat and fever with this medicine, please come and visit me immediately. And meantime, please make sure if you have any symptoms of your vision loss, you have to rush to emergency, and so we can give you prednisolone injection, corticosteroid injection, steroid injection. Okay, and also
And
please make a diary. Okay.
okay, so Dr. Maida, let's go from case to case. Your first case was nocturnal enuresis,
Mm,
right? Like your history went again up to
yes.
7 minutes 30 seconds. Somehow you are
Okay.
asking nicely in the history. Your history is in a pattern, template is nice, but again it's getting longer. Like 7:30 minutes, it should be like around 5, because here if it's
Okay.
around 5, then there it might be
Mm,
6 or 6:30. But here if it's 7:30, then it might take
mm,
more
mm,
than that over there, because
mm, mm,
we get anxious in the exam hall somehow.
mm,
So try to cut
mm,
it down, like only relevant question and active listening. When patient told you like the name and age and how many times a week,
mm,
then we don't have to ask again. And
mm,
secondly, you didn't miss any point. I would say the uh, case was completely fine. From
mm,
patron to fluids to toilet habits, you didn't ask like how many times he void, or does he go to toilet before going to bed. This
mm,
one
mm.
question was missing.
Yes. Mm,
Bowel habits you
yes.
asked. Sleep is also important. That
Mm,
and does he sleep so deep? Is he are you able to wake him up easily, or he's a deep
mm,
sleeper? Okay,
mm.
2 points are important, so we need to
Yes.
ask over
Yes.
there. Any
Okay.
psychology, psychosocial history, any major stressors, or how here we need to ask like how is the environment at home? Like
Mm,
everyone mingles, or is there a strict environment at home? Because it could be
mm,
because of that.
mm,
Patient was feeling embarrassed and avoiding sleepovers. Impact on child's life wasn't asked. Like how is it affecting the child?
mm,
And
mm.
Ice was asked red flags. What could be the red flags over here?
Any neurological deficit? Tuft of
Yeah.
hair on the back of back passage? Any saddle anesthesia?
Okay. So daytime wetting is very important. If patient is having daytime
Okay.
wetting, it is red flag.
Okay.
Any frequency or painful urination. Does
Okay.
he avoid
Yes.
going to
Right.
toilet in the morning because of any painful
Mm,
urination? Also,
mm,
constipation with overflow swelling is also a red flag with this.
yes.
And we have to rule out diabetes.
Mm,
So we need to know weight loss or polyuria, polydipsia. Just one thing: is he growing normally, as you asked? So he was normal about, for the weight and height.
yes. Mm-hmm.
Examination mostly not required. Initial tests we can do urinalysis. Negative for glucose,
Mm,
protein, nitrates, glucoside usually. But if you are suspicious, like I might be having fever or any tummy pain, then we can go for urine
mm,
culture. Otherwise, you just have to verbalize that I need to see him, his vitals, his
mm,
temperature, if he has any tummy pain. So after that, if it's needed, I
mm,
might go for a urine culture or any urine test.
mm, mm,
In,
mm,
in
mm,
the management here, the detailed primary care will be done. So, firstly, we will reassure the patient. Like explain the bed
mm,
wetting at 7 is common and it's not the child's fault. And it usually improves over time. So,
mm,
emphasize avoiding punishment or shaming, as you said. You can give him stars or any rewarding system. Second, address what's causing it. Number one was constipation, the other thing was fluid. This was primary nocturnal, so we have to just take care of this physiological or biological things. Start
mm,
the management for the constipation as you did, and more fiber and fluids in the day. Fluids should
mm,
be
mm,
stopped before the evening,
mm,
like 1 to 2 hours before the bed at least, and no
mm,
coffee or cola or tea.
mm,
Behavior in this we can tell him about avoiding every 2 to 3 hours, especially when he is in the daytime, and double voiding before sleep.
mm,
Positive enforcement like toileting and changing bedding, and also involve the
mm,
child in simple cleanup like stripping sheets. But it's a detailed case. You can tell all of this if you finish the history in 5 minutes. So we go
mm,
with these three things: reassurance, the contributory factors, and behavioral strategies. Enuresis alarm. This is first line active treatment. Since
mm,
tell him the patient that alarm sounds with first drops of the urine and it will wake up the child and he will go to the toilet to finish voiding. And also
mm,
it will train the brain bladder connection.
mm,
So it is yeah, there might be a question how long it can be used for 2 to 3 months.
mm,
Okay, tell them that it's a quite
mm,
long journey. It might take 2 to 3 months to see the results. And
mm,
also, if there is need of desmopressin of the or if the patient asks you, doctor, I want a medication for this, then like for short-term control for school trips or sleepovers, cause they might come. My kid is going for a school trip, and I want something for him so he doesn't get embarrassed. So
mm,
you can offer in that time desmopressin.
mm, mm.
And also it have to be taken before bedtime, and also same fluid restriction 1 hour before the dose and until the 8 hours after.
Mm.
Okay.
Okay.
And follow-up and referral is within 3 months.
Okay.
Can we prescribe desmopressin or a specialist will prescribe this?
After taking the specialist opinion, but primary we do it. Secondary enuresis we mostly refer.
Okay.
Again, doctor, it's on the local guidelines because somewhere you can give, somewhere you cannot. So always
Mm,
tell there after taking a specialist input. You will be always safe by
okay.
saying it.
Okay.
Second
And
Specialist.
case was
also,
Okay.
Dr. Musara, one
Yes.
more question. For aneurysm alarm, should we send the child to the special clinic, as in local clinics, these alarms are not available?
Yes, if you are opting for, but it doesn't have to be like so in detail. If the SP asks you from where I can get these alarms, so yes, you can. Otherwise, you will just have to verbalize
mm,
that I am putting him on the alarm aneurysm.
mm,
And
Okay.
also, nocturnal aneurysm, we need to ask for stress and any bullying at school, or he's skipping the classes, any one of this. Like, is he getting bullied because of it? And is he skipping classes to know how much the patient is suffering? Safety netting at
mm,
the
mm,
end.
mm,
Any, uh, as you asked, any new neurological signs, then they have to present as soon as possible. Okay, so
mm,
next case was scabies.
mm,
Some I told you the occupation right away, but if the patient doesn't tell you, ask them because it's very
mm,
important. Like in this case, she has to refrain her job until she gets better
mm,
with this disease.
mm,
And even
mm,
if the examination is gray, if the examination is gray, you will do vitals. But if the examination is not required, then don't do
mm,
anything. But if it's gray,
mm,
then you still should say, I want to do the vitals.
mm, mm,
I guess follow up was missing here in SKB's case. When to follow up. And did you give the
mm.
similar medication for the
Yes,
kid
permit,
and husband, right? You
yes,
said it for the
permethrin
house
5%.
also.
Mm,
Yeah.
mm,
So in this case,
Um,
what we have to see, yeah,
no, continue. You can carry on.
okay, yeah. Here, what's important? Duration, distribution, itching, past treatments. Mostly, patient is using moisturizer or mild steroid creams, but here she is not
mm,
using anything. Explain the diagnosis.
mm,
This is typically caused by a bug. We call it scabies, and it will get
mm,
better. But you including your household, has to be treated all together. And as you told,
mm,
all your treatment was mostly up to the mark, like permethrin. We started for the whole body from jawline or ears down, including fingers and nails, and down to the soles. And in children, often
mm,
apply to the scalp and face, like avoiding eyes
mm,
and mouth as well.
mm,
Leave it for 8 to 12 hours and then wash off, and again repeat it after 7 days.
mm,
Environmental, you told, clothes used in last 2 to 3 days, they have to be like above 50 degree or just for high temperature, and plastic bags for at least 72 hours, 3 days.
mm,
And itch and expectations, you already gave oral antihistaminics. If it's too much, then you can go for mild or moderate topical steroids, but only for the short course. And ask for
mm,
emollients to reduce the dryness.
mm,
Follow up is mostly after 4 weeks if not improving. Otherwise, the treatment is fine. And if
mm,
it's crusted and very bad scabies given on the picture over there, then we also have to
mm,
involve dermatology and infectious disease department.
mm.
Okay. And third case, uh, Dr. Maida's third case was, you said, temporal trigeminal neuralgia, right?
Trigeminal. Yes, yes.
Okay. So, but it was temporal arthritis. What could be the differentiating point of these two?
I did not mention temporal arthritis because she was complaining sharp pain, one thing, and second thing,
Mm.
on exam, on when I asked on history, she did not mention any VN change. But on examination, you told that there is slight reduce in visual acuity. But on history, there was no problem in VN. So that's why I did not tell temporal arthritis.
I
Okay.
think there
So,
is history
doctor,
of fever and weight loss. I think that's one.
And
Yes, there
also
were,
there
and on
was the
examination there was
changes.
some fever
Yeah, there was changes in the vision changes. She said, "I feel blurred when I'm getting these episode."
sometimes. Yes. Mm-hmm.
Yeah, and it's actually the tenderness over the temple area while combing the hair. This is the
Mm-hmm.
one and the most important. And if you're still confused between trigeminal, you can ask, uh, does cold air feel very
Mm-hmm.
bad or triggers the pain? Because even the air will be causing it. And jaw
Mm-hmm.
claudication is positive in temporal, also visual symptoms also. And she was having low grade fever and a lot fatigue.
Mm-hmm.
So on the examination, temporal artery area tender, thickened, reduced pulsation. Okay. Most of the time when temporal arteritis is suspected, sometimes patient was telling you it always stays the dull ache, but when I touch it or comb my hair, then it gets sharp. So this is two different
Okay.
things. Trigeminal and trigeminal just stays for 2 to 3 minutes, and it was 7 to 8. Trigeminal will be 10 out of 10. People with
Okay.
trigeminal neuralgia might attempt suicide or gets homicidal. That's the score of their pain because of the score of their pain. Mm.
Mm-hmm.
So in this case, the
Okay.
primary care, we will just immediately, this is the emergency case kind of high suspicion of GCA or temporal arteritis. We might start the dose of the prednisone 40 to 60 milligram daily, and we will refer the patient. Urgent
Mm-hmm.
referral same day to the rheumatology or ophthalmology. Most likely ophthalmology if in the acute loss of vision, but here in this case, when the patient is not having acute loss of vision, we can send for the rheumatology. And biopsy will be done within 1 to 2 weeks. What
Mm-hmm.
investigation we can tell to the patient? Um, ESR, CRP, CBC, urea electrolytes, LFTs, and all the other baselines. If they are
Mm-hmm.
going to start on the steroid, sometimes patient is already taking steroids and they are having temporal arthritis, they might come to you having backache, bony pains. Then in that case you will run for the lipids, glucose, bone profile, vitamin D to see any long term effect of steroids. Okay.
Mm-hmm.
Treatment often for 1 to 2 years, and gradually we will taper. And
Mm-hmm.
meanwhile, bone protection like calcium, vitamin D can be prescribed side by side. Safety netting, just tell the red flags and when to present to ER. Okay.
Okay.
So, and one more
Dr.
thing,
Musarraf, I have
LMP wasn't
okay.
asked. Even though she's 72, we can ask like, when did you get your
Mm.
last periods? So she will tell
Okay.
you.
Mhm.
Mhm.
Okay.
And you got only 1 minute for the management plan. I felt in this case
Mm.
went so lengthy.
Yes. Mm.
Yes, you were asking something.
In the first case, nocturnal aneurysm, the mother said she did not try any remedy yet. So I told her
Mm.
to give less water and put an alarm at night and encourage your child to get up and go for washroom. So I did not mention aneurysm alarm. I mentioned regular alarm. So regular alarm is the first thing before aneurysm alarm. Is it like that?
No, as far as I know, the non-pharma is to reduce the fizzy drinks and things like that, and then aneurysm alarm. Because
Mm,
we don't know regarding when to
mm,
set the alarm. It could be early, it could be late,
mm,
but
mhm,
alarm settings can be only guided by aneurysm alarm.
mm,
Because as
mm,
soon
mm,
as patients, if there is 1 or 2 drops of urine or something like that, or bladder gets filled up, then it alarms.
mm, mhm. Okay.
Okay.
Mm.
Okay. So, Dr. Kamlesh, are you ready?
Yes, yes.
Okay. Your
Very
patient
good.
is Mr. Ali, 55-year-old male, came to discuss his problem with you. Please proceed with history, examination, and management plan. Your time starts now.
Hey, Mr. Ali, my name is Dr. Kumar. How may I help you today?
Actually, doctor, I'm here for my regular blood pressure and sugar cholesterol control, but they told me that it's high. But even though I'm feeling well in my life,
Sure, Mr. Ali. Can you tell me something more about your blood pressure and cholesterol?
Dr. Kamlesh, I cannot hear you clearly.
Yes, Mr. Ali, can you tell me something more about your blood pressure and cholesterol?
Yes, doctor, I just went for these lab reports. Should I tell you? It's about my cholesterols.
Mm-hmm. So, can you show me your
Yeah.
results, please?
Okay, blood pressure reading is 148 by 88. Lipids, total lipids 6.8.
Mm-hmm.
LDL 4.2, HDL 1.0.
Mm-hmm.
Triglycerides are mildly raised. 10-year risk is 15%.
15%. Okay. So, Mr. Ali, to understand better about your condition, is it okay if I ask you a few more questions about your condition?
Sure, doctor.
Okay. First of all, I want to know about, do you have any idea what is in this result?
Doctor, I feel the fat is increased in my body.
Mm-hmm. And is there any specific concern about this result?
No, doctor, just I'm concerned. Like, do I have to do something because my father, he got some heart attack and now I'm worried.
Well, I'm here to help you out. And apart from this, any clarification about your results? Is there anything else you are expecting?
I just want to know, do I need any medications?
Sure. So, Mr. Ali, can you tell me since who write for you this labs?
I went to the GP firstly and
Mm-hmm.
I told him like I feel like sometimes I'm getting so much sweaty and putting on weight. So he
Mm-hmm.
told me to go for these lab results.
Okay. And can you tell me before this, are you the known case of high blood pressure?
No, doctor, this is the first time I got high blood pressure.
Okay. And apart from this, have you noticed in recent past any problem in your chest, like any difficulty in chest?
No, doctor.
Any difficulty in breathing?
No, doctor.
Any headache?
No, doctor.
Okay. And apart from this, in the past history, are you using any type of medication for any purpose?
No, doctor.
Okay. And okay, how about your sleep? Is your sleep is okay?
Yes, doctor, it's fine.
Have you ever noticed you have to wake up in the night?
No, doctor.
Okay. Have you noticed any vision problem?
No, doctor.
Okay. And have you apart from this, in the past, what do you do for the living, Mr. Ali?
Doctor, I am accountant. I work as an
Okay.
accountant, so it's a sitting
Mhm.
job mostly.
Sitting job. So are you getting time for the exercise on regular basis?
No, no, doctor.
Okay. And any of your family member has suffered from the high blood pressure,
No, doctor.
high
Just
sugar levels?
my father had this heart attack at 60.
Uh-huh. And how is he doing now?
He died because of it.
Oh, I'm sorry to hear about your loss. So, apart from this, with whom do you live at home?
I live with my wife and two kids.
How are things at home? Any
Everything is
stress?
good. No, doctor.
Okay. And do you smoke?
Yes, doctor, I do.
Have you ever think about quitting smoking?
No, doctor.
And how about if I provide you some literature, you go through it, and we will fix another appointment once you are ready to quit the smoking, if possible for you?
Sure, doctor.
Thank you. And apart from this, do you drink alcohol?
Yes, doctor. On weekends,
Okay, and how much amount?
2 to 3 glasses in one sitting.
Okay. Okay, and apart from this, so you have come to discuss your results, and you have told me that you want to know, and you are a little bit worried about that. You don't want to be like your father has got the cardiac problem, right? Means heart problem, right?
Yes, doctor.
Okay, and so how about if you permit me? So I will do the general physical examination as well as examination of your heart area, during which I will call for the chevron help if you allow me. And for this examination, you may have to up the shirt up to the from the front area and back area. So I will have a look at your chest area. I have to touch it. I have to listen the sounds of your heart, how it sounds for you.
Sure, doctor.
Okay, so I will do for you pulse in your both arms. I will check blood pressure in your both arms. I will see the neck veins. I will see the back of your eyes. I will listen your heart areas. And is there anything?
Okay, so blood pressure 148/88 with
Mm-hmm.
changes on the retinoscopy.
Mm-hmm.
Otherwise normal.
Sorry, in the retinoscopy, is there anything?
Yes, changes due to hypertension.
Okay. And do you have any idea about your body weight to your height?
29.
And how about your food habits, Mr. Ali?
Doctor, it's very bad actually. I'm taking high
Mm-hmm.
salt, fried food, red meat. I'm fond
Mm-hmm.
of all this.
I see that. So, Mr. Ali, as you told, I think before you told you are not doing any exercise and your weight is on the upper side. So, most probably after having these all things in consideration, you are suffering with the two condition. One is your high blood pressure. You have high blood pressure. Are you getting me?
Yes, doctor.
Okay, and your cholesterol levels are increased. So actually what happens if we are not going to control it, it will have a long lasting effects like high blood pressure inside the body for a continuous time, having the effect on your eyesight, on your blood pipes, on your kidney as well as your liver. Are you getting me?
Okay, doctor.
Okay, as well as the high cholesterol levels sometimes are making resistance or making more resistance in your blood pipes. Okay, and in the long term, it is also causing some heart problems. Are you getting me?
Yes, doctor.
So how about if we'll discuss about and I give you some suggestions to have some changes in your lifestyle and some other advices to overcome this without medication. Okay. Some and the
Sure,
other
doctor.
medications we will also discuss about. First, I will discuss with you. So as you told that you are not going for exercise, I will suggest you if you are going for exercise and you are reducing your weight, it will have a good effect on your overall, and it is also making the blood pressure on a little lower side. Are you getting me?
Okay, doctor.
Okay, and try to take a healthy diet. We call it a DASH diet. I will provide you a literature. You can go through. That diet will help you out also.
Okay.
Okay, and reduce the salt, reduce the fizzy drinks, reduce the junk foods to eat. Okay, and also avoid from the things containing high cholesterols. Okay, and apart from this, I will also try to have a good sleep. For good sleep, I will provide in other literature which is telling you about the sleep hygiene.
Okay, doctor.
Okay, and about that one, and sorry, I didn't do the lab test. How about if I write for you some basic lab test in your case?
Like what, doctor?
Renal function test to see the kidney status, liver function test to see your liver status. Okay, and you have already done this cholesterol levels, so this is very good. And apart from this, I think once the results will come, and as your Q risk is more than 15, so I will suggest you some medications. One medication to control your blood pressure, okay, while the other
Okay.
medication to lower down your cholesterol levels. How about it?
Okay, doctor. Time's up.
Okay. Okay,
Give
so
me
I will,
1 minute, Dr. Kamlesh.
yeah, I will prescribe for you AC inhibitors. Okay, we call it AC lisinopril. Okay, 5 milligram,
Mm.
and we will also check your blood pressure for the next 1 week, and you will bring that paper with you so that we will go through how it is controlling your blood pressure. And also, I will start for you a tablet. We call it atorvastatin, 20 milligram, to control your cholesterol level. Okay. And in the meantime, before our next consultation, if you feel anytime any chest pain, any shortness of breath, or any other new symptom, headache, you can visit me, the nearest emergency department. Is it okay with you?
Okay, Dr. Kamlesh, almost 1.5 minutes above
Mhm. Yeah.
the expected time. So
Mhm.
basically, it should be done in 10 minutes. If you do it here in
Yes,
10 minutes, in fact, I would say should do in 9 minutes.
sure.
So because there will be examination might take a bit long because SP will
Mhm.
stand, go on the couch, let you
Yes, I
examine
got you.
and get back, right? So we have
Sure.
to be very cautious about. Even though many people have this time management problem, even though we saw in our exams regarding the time
Mhm.
management, we know everything, but when the time is gone, we cannot do anything else. So your next case is Mrs. Laila, 19
Mhm.
years old female, came to discuss her problem with you. Please proceed with history and management plan. Examination is gray. The time starts now.
Okay, Miss Leila, good day. My name is Dr. Kumar. How may I help you today?
Doctor, actually, my skin is really bad and nothing I buy over the counter seems to work.
I can understand this. So, Miss Leila, can you tell me something more about your skin problem?
Yes, doctor, it's been 3 years now and it's
Mm-hmm.
getting worse over 12 months.
Mm-hmm.
Actually, I have these bumps on my face and upper jaw, upper
Mm-hmm.
back, and the chest.
Mm-hmm. Okay, so Miss Laila, is it possible? Can I see your rashes?
Yes, doctor, just I'll pause the timer sending in the group.
Okay.
You tell me when time starts again.
Okay. So, Miss Laila, to understand better about your condition, is it okay if I ask you a few more questions about your condition?
Sure, doctor.
Okay. So, you have this problem, skin problem since how long?
3 years now.
3 years now. Okay. And does it started gradually or suddenly?
Started like little by little, then it's now on my face a lot.
Face a lot. And you told me that you have this on the back and chest also.
Yes, doctor.
Have you ever tried any medication for that?
Many medication, doctor, over the counter washes and topical
Mm-hmm.
and oral treatments, but nothing is
Mm-hmm.
working for me.
Okay. And have you noticed that anything is increasing it?
I don't know, doctor. Just feel it's hormonal issue, maybe.
Mm-hmm. Anything is relieving it as well?
Nothing is relieving, doctor. I'm really embarrassed because of my
Mm-hmm.
skin.
I can understand it's really difficult for you. So, have you ever noticed any discharge from this?
No, doctor.
Okay. Are you using any makeup on the regular basis?
Yes, doctor, I have to. And because it's very embarrassing for me to go out like
Mhm.
this.
Have you ever noticed have you gone through the ingredients if it is the oily one makeups you are using?
I mostly use non-comedogenic makeup.
Okay, and have you noticed the sweating in your face area?
Not a lot.
Okay, have you ever noticed that you have more hair growth on your upper lips?
No, doctor.
And is it okay if I ask you a few personal questions if you don't mind?
Sure, doctor.
Sure. So, how about when was your last menstrual period?
2 weeks ago.
Okay, are you sexually active?
No, doctor.
Okay, and apart from this, have you noticed anything like sometimes you have flushing of your face?
No, doctor.
Okay. Are you using any type of are you sorry, I forgot to ask you, is your menstrual cycle regular?
Yes, doctor, it's regular.
Okay. Have you ever tried any medication for menstrual cycles?
No, no.
Okay. Okay. And apart from this, have you noticed any fever,
No, doctor.
any joint pain?
No, doctor.
Okay. Have you noticed that you are low in your mood for last 2 to 4 weeks or more?
Yes, doctor, I'm really in low in moods at times and I'm
Mm-hmm.
avoiding social gatherings
Mm-hmm. Since how long?
since long 1.5 years.
Okay. Have you noticed that you are not interested in the things which you previously were since more than 1 month?
Doctor, I'm interested, but I don't do just because
Because
my
of
face looks ugly.
Sure, I can understand this, and I will try to help you out. Okay, so have any of your family member have suffered from the same condition?
No, doctor. My friend, one of the friend, is having similar condition.
Mm-hmm. Okay, and have you ever used any medication on a regular basis or over the counter?
Over the counter, I used like 5 to 6 days. Then I left it. Then again, I used, but it's not working for me.
Only for this face problem, nothing else.
Yes, doctor.
Okay, and how about your eating habits?
I'm mostly taking sweet candies
Mm-hmm.
and chocolates and junk food.
Okay. Mm-hmm. So, what comes in your mind regarding your condition?
Doctor, I think it's hormonal.
Okay, and is there any specific concern about your condition?
I'm just worried about permanent scarring and appearance and social anxiety.
And what you are expecting from me in today's consultation?
Something stronger like tablet. Or
Mm-hmm.
doctor, can you give me that isotretinoin antibiotic?
We will discuss about it. And how you feel that apart from that you are not going outside and you are getting a little low side on the social areas. So how it is impacting in any other way for you?
Doctor, I am just taking leaves from university
Mhm.
and it's affecting my studies also.
Studies also. Okay, with whom do you live at home?
I live at hostels with my friends.
Okay. So what I have understood till now, Ms. Nalaya, you are suffering from this skin problem since long time and you are worried about that you want a solution for this and you are worried about that whether it will increase or how to overcome this and you are expecting from me to sort it out and to give some medication for this, right? Anything else you want to add?
Yeah. No, doctor.
Okay, I forget smoking and anyways, smoking and alcohol, I will ask me. So, after having this all things in consideration, it's mostly seems like you are suffering from a condition which call in our medical term the acne vulgaris. Do you know about it?
Yes, doctor, it's acne.
Yeah, it's acne. Do you have what do you know about the acne exactly?
I just know it's hormonal.
Actually, see, this is a condition that occurs when the skin pores become plugged with the oil and the dead skin cells. Are you getting me?
Yes, doctor.
Okay, the good thing is it's not contagious. It's not spreading from person to person. Okay, and even there's no any role of any sweating, dirt, or any other thing for this one. Are you getting me?
Okay, doctor.
Okay. Yes, the good thing is it's treatable, but it takes a longer time to treat. And how about if I will discuss with you a few lifestyle modification followed by some medications?
Sure, doctor.
Okay, first of all, I will give you just do some yoga and exercise, okay, to reduce your stress. And do you have any idea about your height to weight ratio? Height ratio to weight?
23.
Sorry, 23.
23.
Okay, and as you told, and if you take the healthy diet, it will also help you out to decrease your symptoms. Are you getting me?
Yes, doctor.
Okay, apart from this, try to use the cleansers for washing your face, which are oil free. Okay, and
Mm-hmm.
don't try to squeeze or prick the skin areas. Okay, avoid makeup if possible for you, and if you are using it, try to remove it before going to bed. Okay,
Okay, doctor.
and as you are using more things like sugary in this one, it is also sometimes increasing the symptoms. So it is good for you if you can avoid the sugary items. Okay, and try to take
Okay.
more whole grains and fruits. Okay.
Okay. Okay,
And,
doctor.
as you are concerned about to start the retinoids, your condition needs the retinoids, but actually we cannot start it. This is the domain of our dermatologic skin specialists. For that one, I will send you. For a time being, I will start for you the medication over here. Okay, like cream benzyl peroxidase. Okay,
Mm-hmm.
along with the gel adapalene, this both combined you can use it on the daily basis. Okay, and this is the first line treatment, but in your case maybe it needs retinoids. So for we will see for 1 to 3 months how they are working for you. Okay, and in the meantime I am giving you the referral for the skin specialist to discuss about this retinoids. And if you are planning for the marriage or near future, anything like that, because this retinoids are not allowed to take during the pregnancy. Are you getting me?
Okay, doctor. Time's up.
Okay, anything else you want to discuss? Thank you.
No, doctor. Okay, Dr. Kamlesh, your third and last case is Mr. James, 45 years old male. Can we discuss his problem with you? Please proceed with history and examination and management plan. Your time
Mr.
starts now.
James, 45. Okay, good day,
Yes.
Mr. James. My name is Dr. Kumar. How may I help you today?
Doctor, my shoulder hurts when I lift my arm.
Okay, so I can understand it's really difficult for you. Can you tell me something more about your shoulder problem?
Yes, doctor, actually, it's been 3 months now. It's getting worse and worse. And
Mm-hmm.
mostly outside of my shoulder, it feels so much pain when I'm moving my arm.
Uh-huh. Okay, so is it okay if I ask you a few more questions about your shoulder problem?
Sure, doctor.
Okay, so this pain started 3 months back. So how it all started? Suddenly or gradually?
Gradually, doctor.
Okay, and exactly which area of the shoulder is hurting you?
Lateral side of shoulder.
Lateral side of the shoulder. And is it
Hmm.
in the one shoulder or in the both?
One.
Is there a specific time of the day you are feeling this pain?
No, doctor, all the time whenever I'm moving my arm.
Okay, any specific movements in any specific direction it is increasing more?
I feel when I take my arm above head, it gets
Mhm.
worse.
And have you noticed anything is relieving this pain?
Rest.
Okay, let's suppose if I ask you what type of pain exactly it is.
It's just aching kind of pain.
And if I ask you the severity of the pain, like 1 is minimum and 10 is maximum, how will you rate it?
Doctor, normally it's 2 to 3, but when I'm moving my arm, it gets like 7 to 8 sharp pain.
Have you used any medication till now for that?
Only paracetamol.
Okay. Have you noticed this pain is in anywhere else, like in your elbow area, and your wrist area, or your neck area, any of the areas apart from shoulder?
No, doctor.
Okay. Have you any injury in the same area before this starting of this pain?
No, doctor.
Have you noticed any weight loss during this all time?
No, doctor.
Any redness or pain on touching that area?
No, doctor.
Any fever?
No, doctor.
Okay, and Mr. Saik, do you have any problem in the past, like high blood pressure,
No, doctor.
high sugar levels?
No, doctor.
Okay, and are you using any type of medication on over the counter or regular basis?
Just this paracetamol.
Mm-hmm. And is it working for you?
Sometimes, doctor, but not a lot.
Okay, and what do you do for a living?
Doctor, actually, I work as a plumber, and sometimes when I'm doing overhead pipe work, I cannot even lift my arm.
Uh-huh, I see. So, so apart from the, with whom do you live?
I live with my wife.
Okay, and how are the things at home?
Everything is good.
Okay, how about your eating habits?
Doctor, I'm trying to eat healthy.
Mm-hmm. Good, very nice. And do you smoke?
No, doctor.
Do you drink alcohol?
No, doctor.
Okay, and what is your idea about your pain?
Doctor, I'm worried it could be frozen shoulder.
Frozen shoulder. Okay, and is there any other specific concern about your condition?
Doctor, I just like maybe need any surgery.
Okay, and what you are expecting from me in today's consultation?
I want any diagnosis or exercises.
Okay, and how do you feel that it is impacting on your regular life?
Doctor, my work is disturbed, my sleep is disturbed, and overall, I just cannot bear it anymore.
Okay, and till now you have told me that you have this problem and you are thinking it can be the frozen shoulder and you are concerned about that it can increase or deteriorate. Okay, and you want me to do to manage it. Okay, so is there anything else you want to add?
No, doctor.
Okay, so how about if I do for you general physical examination as well as the examination of your shoulder area?
Sure, doctor.
Okay, so I will check the pulses in your both arms and blood pressure in your both arms. I will see the your shoulder area from the front, from the side, from the back. Have a look at that. I will touch it. If there is any pain, you can stop me anytime. Okay, and I will feel the joints of the shoulder. I will see the movements at the neck and all the movements at the shoulder, like extension, flexion, rotation, lateral, medial rotations, abduction, adduction. Okay, so is there anything?
Anything else you want to do specially?
For this one, I will give one test to push against the wall. So I want to see your back area of scapula. Okay, and I will do a can test to hold a can and make it on the halfway and just rotate your arm like you are emptying the can. Okay.
Okay.
And is
And what
there
else?
anything when you are raising your arm above the shoulder area?
Just I'm feeling pain while I'm raising it.
Okay. So having this all things in consideration, it most seems like that you are suffering from a condition we called it rotator cuff shoulder impingement.
Okay. Okay, doctor, what is
Okay.
it?
Actually, as you are working as a carpenter, so because of the repeated movements at your shoulder, you are encountering this problem. Are you getting me?
Yes, doctor.
Okay, so how about if we will discuss about some lifestyle changes, and I will tell you that this pain will be increased if you will continue your movements like this. So how about if you have another option, or you can reduce the your work, or you can do some other work if you know about.
Sure, doctor. I will try to talk to my employer, but I don't know, doctor. Can you write any letter?
Don't worry about this. For that one, I am here to help you out. I will write a letter to your company and mentioning
Mm-hmm.
that what is your condition, and will suggest them if they can help you out to change your work type. Okay, and also apart
Okay.
from this, I will write a letter to the occupational therapist in your company to suggest for you some therapies. We call it like exercises, physiotherapies, and also so you need now occupational therapy as well as the physiotherapy to overcome this pain. Are you getting me?
Yes, doctor.
Okay. Apart from this, I will give you some suggestion painkillers. Do you have any problem in your gastric problem, or you have some burning in your epigastric area or your stomach area, or you are feeling nausea, vomiting after eating?
No, doctor.
Okay. Are you using any smoking alcohol? Sorry, smoking
No, doctor.
alcohol.
Uh, no, doctor.
Okay. So then I will write for you one tablet. We called it NSAIDs, ibuprofen, 400 milligram,
Mm.
three times a day. Okay. And apart from this, I will tell you to keep this medication with you whenever you feel any pain. You can use that medication for 2 to 3 times a day once you have more pain. Are you getting me?
Okay. Mm.
Okay, and apart from this one, I will okay, and I will check you after 4 weeks. Okay, after having these all things in consideration, once you go through the physiotherapy, occupational therapy, and once your pain is going to subside, I will give you a follow up after 4 weeks to see how it is improving.
Okay,
Okay.
doctor.
And in the meantime, if you feel any severe pain, or you are feeling even after taking the painkillers, your pain is not subsiding, okay, any swelling in the area, any redness in the area, any fever, you can visit me anytime.
Okay, doctor.
Okay, so as you are concerned about it is like the frozen shoulder, so I assure you it is not the frozen shoulder. And good thing is with the medication and with the proper treatment like physiotherapy and occupational therapy, we can
Yes.
overcome this problem. Okay,
Okay, doctor.
is there anything else you want to discuss?
No, doctor.
Okay,
Okay.
so still, if there is time, so I will tell you to take a healthy diet, do exercise on the regular basis. Okay,
Time's up.
and okay, thank you. Take care.
It was up. Yeah. Okay.
See
Okay,
you.
Dr.
Bye.
Kamlesh. So this was your last case. Let's go from the first case. This was hyperlipidemia,
Mm-hmm.
right? Patient even though came for the first time with the blood pressure and his lab reports. You started on the medications, right? But your history was quite prolonged, but it was concise, and it was you did examination before, then you went to the diet and BMI again. Try to keep it in a flow, like ask history before, ice before, summarize it, and then move to the examination. So after examination, if there are any tests, investigations, you can do it, and after that you can just go into the management plan. No here and there. Okay. Otherwise, you ruled out OSA, vision, and you didn't ask for hypothyroid symptoms because of increasing weight. We need to ask any is she feeling more is he feeling more cold than
Mm-hmm.
others? Okay. And diet and exercise, every patient with the CVD risk or even this lipid profile report asked diet earlier.
Yes, in the
I
psychosocial.
Yeah, and you asked ice first. It was very nice. And also here, what we can do in the management, explain to the patient you did a lifestyle modification, smoking, diet, weight, exercise you did. Um, Pharmacological hypertension, even though it's just 148 by 98, we will be starting him.
Mm-hmm.
Why? Because already the CV score
CV score is 50.
is more, and moreover, there is a finding of end organ damage in the eye. Yeah.
Yes.
So we will start the medication ACE inhibitors most likely in this case. Lipids will be you will start on the statins, 20 milligram atorvastatin basically, and repeat LFTs in 3 months.
Yes.
Did you tell him about the repeat of the test? Whenever
And
there is a lab report,
yes.
yeah.
LFT is every 3 month, and the cholesterol depends on 6 month. First 3 month, and once it's stable, maybe 6 month or 1 year.
Yes. And also that whenever there is a lab report, you can ask, have you ever went through any lab results before this? Or as you asked, why did you go for this? That was fine also. And you said dash diet is only for blood pressure
High
control,
blood pressure.
mostly decrease salt intake. Here we will say more like Mediterranean diet because more
Mhm.
vegetables, more fiber we need to add in his diet.
Sure.
Mm.
And
Okay. And otherwise, your case was good. Next case was acne. You asked about flushing in 19 years old. I wanted to know, like, what was your differential on that?
this the other condition with the telangiectasia and like
Rosacea.
rosacea.
Okay, okay. You can say redness instead
Okay.
of flushing. Yeah,
Okay.
flushing and redness one and the same thing. I was going
Yeah.
towards that
Mhm.
premenopausal
No, no,
symptoms.
no.
Fine.
This is for the
That's
rosacea.
yeah, that's right. And psychosocial skipped. You ruled out PCOS and other and her
I think actually that's why
past
in the
medical
ice
history.
area, I got it that I asked regarding the smoking, but I forget at the first time.
Mhm.
In the first.
Mm. Okay. And safety netting wasn't done. Explain. There are a few things in acne we need to tell. It is not related to dirty skin or anything like that, but still
That
we
one I
have to
think I
keep the
told
skin.
her regarding all
Yeah,
like this is not
but
like
here
this.
we have, but here we have to add one point like we still have to keep the skin clean and clear and less usage of makeup or any camouflage if she's using. Or third is it's not contagious, as you said. Fourth, diet wasn't addressed. She was using more chocolates and fatty foods. Just
No,
one
I
minute,
think
okay?
I mentioned this one regarding the means sweet things. Like I mentioned that.
Okay. So, where was I, Dr. Kamlesh? What did you say? Sorry, I didn't hear.
Regarding the sweet, I think I asked and I told her to reduce the
Yeah, here
sweet.
we need to add one sentence. It is not because of your dietary habits, but the healing might take time and will not get better because of more sugary food. So, since you are using this medication, try to avoid sugary drinks and foods and fried and fatty foods to see the improvement because of the medications.
Yes.
She said oral antibiotics or isotretinoin. Here we can just start. And yes, if the patient is insisting on isotretinoin, what we have to tell for at least 2 to 3 months, she has to take this similar medication at least. She was taking it for 1 or 2 weeks, then skipping it. So compliance on the medicine is very important. We have to tell and for at least 2 to 3 months, you have to keep taking this medication.
I think I told her
And
and I told for isotretinoin because this is a specialist
yeah,
domain, so I will refer
yeah,
it.
yeah. You said it, but still you have to emphasize on the compliance of the medication. She was skipping it, like taking 1 week, then skipping it. Okay, 8 to 12 weeks follow up. Otherwise, your case was fine. These are 1 to 2 points I just add in case you just remember it. It will be outstanding case. Otherwise, right now it's up to the mark. Third was shoulder impingement. In examination, painful arc should be done. Painful arc test. You did empty can and nears test, but painful arc is to check supraspinatus specifically, and in shoulder impingement, mostly supraspinatus is im- mm, affected. This case was one of the most common
Can you hear me? Hello, am I audible? Hello.
Yes, Dr. Kamlesh, you are audible.
Thank you. I think doctor may be waiting for. Thank you.
Hello?
Yes,
Hello?
doctor. Yes.
Sorry, I got disconnected. Okay, I was saying
Mhm.
that after 3 to 6 months of good conservative management, then we can think about steroid injection. Otherwise, no. Safety netting
Yes.
6 to 8 weeks to assess progress with the physiotherapy and pain control.
Yes. I think I have done enough to send for occupational therapist, physiotherapist, change the
Yeah,
job later for that, and painkillers. And after four
yes,
weeks,
you did
proceed with that.
nice. This case was up to the mark. Okay.
Thank you.
Thank you all. And if any queries, we can discuss it in the group. Thank you.